Good morning, ladies and gentlemen. It's my great pleasure to welcome you to this important announcement. And I do this on behalf of the International AIDS Society, the pediatric priority known as CIPHA. And, you know, we are really turning a spotlight again this morning on the very critical component of the HIV epidemic, which is pediatrics. And what we intend to do in the next few minutes is really highlight why this priority is key, and then just show you how together in a collaboration with ViiV and this fantastic grant, how we are hoping to answer and provide some of the solutions to the problem that faces us. So we're very, very excited in that certainly in the last few months, year or so, there's been an incredible coming together of minds around the fact that the pediatric epidemic is far from over. We've made some wonderful strides, and we should celebrate those, but there is still much work to be done. And as the very, I think, wonderful, memorable satellite showed last night, that the essence of the pediatric epidemic is that those children are growing with us. As the epidemic ages, those children are aging, and they really need our intervention, not only in terms of getting new children onto treatment and making sure their lives are preserved, but making sure that actually they live into adulthood with quality lives and as side effect free as possible. So really, this morning is about how do we make sure that children don't fall through the cracks, but also those that get onto treatment, how do we make sure that they make it into adulthood? And that really is the essence of this morning. So it's my great pleasure to announce that the CIPHA grant is continuing. A couple of years ago, we were pleased to announce that through a wonderful grant from ViiV, the pediatric priority was born within the International AIDS Society. Now, I want to point out to you that this is one of 3 priorities in the International AIDS Society. It's a member organization. We have 16,000 members around the world, and we run these kinds of conferences. Our job is about the HIV epidemic, and yet we have noticed, and we have intentionally put pediatrics there as a priority. And that came very much as ViiV recognized that not only do we need to come up with more solutions in terms of antivirals for pediatrics, there are a number of research gaps that remain, things we don't know. And so through this grant program, we are, and through the CIPHA collaboration as a whole, we are doing 3 important things. The first is we are growing a crop of young researchers who are given the task of making sure that they actually address some pediatric or adolescent issues in resource-limited settings. And you'll be hearing more about that. But fantastically, we've been able to add 2 more grantees this year, one of whom comes from Southeast Asia and will be working on liver complications, both due to HIV and antivirals. And the second, doing a really, I think, innovative program in Malawi, looking at severe pneumonia in newborn and young children, and using an innovation called bubble CPAP as a way to try and, provide support for lungs as the child is brought through this difficult time. So really looking to reduce morbidity and mortality. And as you know, pneumonia is a very severe comorbidity that we see in HIV-infected children. So those 2 will be announced tomorrow. But then, even better news, thanks to the grant program, another 4 grants will be awarded in the next few months, and those applications are open at the moment. So we're very excited about that. There are significant gaps to fill. We're looking forward to see what the field brings forward and the kind of talent we can harness around the world. In addition, the collaboration in cohort work goes on. And I want to tell you, this is the most extraordinary collaboration around the world. So CIPHER has been able to gather cohorts, pediatric and adolescent cohorts from around the world. We have 250,000 children in our cohort data bank, and we will be able to answer the really big questions that otherwise could not be answered in single cohorts on their own. This is unprecedented. I don't know if you know how significant this is. You know, it really, I don't know of another field of medicine where this kind of collaboration has come together, and I'm delighted to announce it. And I think it shows you that there is a genuine concern around the world that we have to save our children for the future. And this is exactly what we're in the business of doing. So I'm delighted to announce this and then pass on to my colleagues to really elaborate on why we're doing this and what the heart of ViiV is in terms of bringing this forward. So I'm going to ask Annette Son, who is part of Treat Asia, an expert in the field, has been a great supporter of CIPHER and a key member within the CIPHER organization, and she's going to make some remarks.
Thank you. Thank you, Dr. Becker. As Dr. Becker said, we've had a lot of progress in the HIV global epidemic response that has been discussed over these past few days. But I think a message that we want to get across to all of you is that children and adolescents are still falling behind. They have never made up the treatment gap with adults. As reported by the United Nations just this week, only 1 in 4 children in resource-limited settings who needs antiretroviral treatment is currently receiving it. And for those who get on treatment, their long-term outcomes are not as good as I think we would hope they would be. At the recent HIV Pediatrics Workshop, a study of over 16,000 children receiving care in Africa and Asia reported that within 5 years of starting treatment, 22% were lost to follow-up or died, and 35% had some degree of treatment failure. So if you do the math, that means that under half had persistent treatment success. An example of the type of innovative research that we need to help us understand why adolescents are being lost and failing treatment was presented yesterday at this conference by a CIPHER grant recipient, Rebecca Hodis. She is studying what makes South African adolescents with HIV more or less likely to be resilient or to adhere to treatment. In her study, the reported barriers to staying in care ranged from the cost of transportation to the clinic to fatigue at having to continuously take antiretrovirals and fear of having HIV-positive status disclosed due to stigma. Reasons to stay on treatment and in care included small rewards and incentives from caregivers, like special food or clothes, as well as love and family support. A key feature of her research is that she works directly with local adolescents to hear about their personal perspectives of what it means to be living with HIV, and that then helps to shape her research tools. During various sessions of the conference, we have heard from a number of HIV-positive youth about their experiences living with HIV. They have reminded us that lifelong treatment is a major burden and have asked for simpler and longer-lasting regimens. In addition, they are now actively hoping for a cure in their lifetimes. We need more commitment and collaboration like the CIPHER program between clinicians, researchers, and policymakers in order to close the treatment gaps for children and adolescents. And as Dr. Becker said, I've been involved with CIPHER since the beginning of the program, and there is no collaboration that I am aware of in the world of pediatric HIV that brings together those 3 groups in this way: the clinicians, the researchers, the people who make decisions about treatment guidelines on a national and international level. This is really unique, and we're quite hoping that it will continue for a long time, because in many ways, the pediatricians felt like there was nobody else bringing us together in this way. When the opportunity arose, every major scientist who was invited, every clinician, every policymaker, they made time in their schedules. They showed up. They provided volunteer hours, reviewing grants, sitting on teleconferences late at night, early in the morning, because this is so special for all of us as a community. So we really thank the CIPHER program, the International AIDS Society, ViiV Healthcare, for all of their support for us working on the front lines with these children and adolescents. Thank you.
Thanks, Annette. And so really the people who have made this program possible so far, I'm going to hand over to our ViiV colleagues now. Chip.
Actually, we'll get to ViiV in a moment. I'm flattered, though, to be associated with ViiV so directly. My name is Chip. Thank you very much. My name is Chip Lyons. I'm the CEO of the Elizabeth Glaser Pediatric AIDS Foundation. We're an implementing partner for PEPFAR and certainly also with ViiV. We have several years of collaboration, and that is a word that I'm going to repeat several times just to pick up on Annette's points as well. We're leaving, so let's remind ourselves of the remarkable progress in reducing new pediatric infections, the success and scaling of PMTCT. It's sobering, though, that we are able only so far to get 1 in 4 kids on treatment, and yet we're leaving Melbourne with this target of 90-90-90. One of the sort of sub-themes of the last several days from a number of individuals is that we cannot do business as usual. That's relatively easy to say. It implies we're going to do business differently. Well, how are we going to do business differently? I think Annette just characterized one of the ways that we have to do business differently, this collaboration with the different partners, but also in a context where people are relatively comfortable talking about flat resources. We also have to talk about additional resources or targeted additional investments in a number of different areas, because at the end of the day, we are failing kids. The pediatric cascade is not successful. We're not as good at testing. We're not as good at treating as we need to be. There are questions of retention and adherence as well. And so we need to double down on strategies that do a better job of retaining kids in care. There is interesting, even very exciting news and developments around better pediatric formulations. That's one piece of the puzzle. There are interesting new technologies that are coming out of the pipeline that are going to be introduced around diagnostics, point of care, early infant diagnosis. That represents a different way of doing business. So there's a kind of momentum, I think, and evidence at this conference that we didn't see 2 years ago or 4 years ago at AIDS conferences that are the elements of doing business differently. But, you know, we go from meeting to meeting, whether it's every 2 years or whether it's every year. For parents of a newborn that's infected or exposed, a year is an eternity. And when only 1 in 4 of those kids are on treatment, the implications, I think everyone knows very well what the mortality and morbidity rates are for infected and exposed kids at 2 years and in 5 years. So the phrase, you know, stepping up the pace is not an abstract. It's an easy and a very appropriate, I think, almost profoundly appropriate characterization or theme for the meeting. But we have to do more than, you know, sort of go from a fast walk to a slow jog. The new tools that we need, the new technologies that we need, the new investment and collaboration cannot come fast enough for kids. And I think there are a number of partners, including Elizabeth Glaser Pediatric AIDS Foundation, that are prepared with ministries of health and others to put them into practice. I'll give one specific example of why dedicated additional resources for research is so important. If we were meeting 3 months ago, we'd still be thinking positively about the potential of a cure represented by the Mississippi child. That was rather devastating news, not most importantly for the family, but for everyone else that somehow in the back of their mind were hoping this was a cure and was going to point the new study that was going to be done to really figure out how to take full advantage of that. We don't know all the complexities around pediatric AIDS. We don't know today all the questions that we have to address, for example, around the Mississippi child. So additional resources in this climate for research that are focused on new tools and new partnerships to address pediatric AIDS is the good news that Linda Gale referred to, and implementers like us can only applaud that IES is playing the role it is, that CIFR is there, that ViiV is leading the way it is. Thank you.
Thanks very much, Chip, and really to acknowledge that Elizabeth Glaser Pediatric Foundation has been there since the very beginning and done extraordinary work, and, you know, salute you for that. And I think it is terrific to see that these organizations are coming together, as Annette says now, really with new impetus and with a real sense of urgency. So, you know, soon may we be sprinting to what I hope is an end goal of truly an AIDS-free generation. And that really, to realize that for our children, is the most extraordinary sort of concept. There's no doubt, though, that there will be a cohort of children that we'll be taking into adulthood, and that we are the custodians of their care. So, Dominic, over to you.
Thank you. I must say that I'm delighted again, because we had a press conference about the first grant that we gave to IES for building CIFR in collaboration with IES. Delighted because I am the CEO of a fully dedicated company to HIV and AIDS. And from day one with our team, we had perfectly identified that the HIV disease or condition in children was neglected. And, you know, even if we are very proud about our portfolio of products, you know, as a executive manager of a pharma company, to see still children obliged to, you know, to have crushed pills to get access to their products, or to have no access to products, or to have no basic science around this condition in children, was something that we felt unacceptable. So that's why from day one, we decided to be extremely dedicated to HIV in children. And we have allocated resources, we have allocated efforts, we have a team dedicated to pediatry. And you kindly said yesterday that you had a fantastic symposium, which is the illustration of the dedication, commitment, passion, and energy of our people regarding HIV in children. And that's why we are delighted to be with you today and to once again give to CIFR a new grant of £1.5 million, which will help building on the success that CIFR and IES have built together with us. And with, obviously, Annette and Chip. We are delighted because it's part of what we believe will help addressing the condition that you described. It's part of a vast program of activities that we have at ViiV Healthcare. You know, we have a positive action program which lasts now for more than 20 years, but we have also created a positive in Pediatric Innovation Seed Fund, which is basically trying to sponsor, subsidize new scientific activities, new basic science on children. And that's why we have a collaboration with Tritasia on that. That's why we have a collaboration with Elizabeth Glaser Foundation, because we wanted to invest into basic science for helping discovering what are the key, let's say, biomarkers for children, how can we move from one drug to another one, and so forth. We have a Positive Action Children Fund, which is also dedicated to reducing the number of new children infected by the disease, by reducing mother-to-child transmission. But we are, as a pharma company, dedicated a lot of resources in developing the new drugs, which will fit better the patient needs and the children's needs. And you said better tolerated product, less toxicity, less drug-drug interaction, no food interaction. These are the key elements that you want to have, with the right formulation. And we have not done that only with ViiV. We are doing that in collaboration with generic companies, being Aurobindo for dolutegravir, being Mylan for Carvexa dispersible. We are investing in partnership with others. And that's a key word that all of us, we wanted to highlight today. We cannot succeed if we do not partner. We partner with IES, and we are delighted. Otherwise, we would not invest anymore. We are delighted in partnering with Elizabeth Glaser and Tritasia, because we believe that we all together can crack the problem. And it's not yet there. But we are confident that in building these databases, in giving more access to data to the scientific community and medical community, in working all together. And I would say if we could have more pharma companies, you know, coming to you at the IS, coming to the CIPHER program in order to build that competence, globally speaking, I think we would be even more effective. And even if, there are competitors here, we have a single mission, which is to take care of those children. And if we can do that together, that would be great.
Thank you, Dominic. So you've heard it, the word partnership, and we certainly are looking to expand the CIPHER concept. So the floor is now open. If you could just identify where you're from, and please direct your questions as you wish, if anyone has any. I can see that. Well, I think if everyone's happy, and certainly if there are questions that you'd rather not ask publicly, we will be here afterwards to answer them. I think it just remains to say that if you had any doubt in your mind, then we hope we've dispelled that pediatrics is very much center and heart of our response to this epidemic. It is critical that we safeguard the children who are born to mothers infected and unexposed, because we need to understand what they face. Children who fall through the cracks and are born with virus, it's very important that we find them, get them onto treatment, and then that those children are actually taken through into a safe transition into adulthood. That is no small task. I mean, we're talking about a large number of years for a mother or a caregiver who might face this, daunting task of seeing their child, the great joy of seeing their children grow into adulthood. And I want to just, if you could bear with me, last evening, under the wonderful inspiration of Katie Hayward from ViiV, a video was made together with input from Treat Asia and other organizations around the world to actually go into the field and ask these children, what is it that it means for you to live with virus? And what do you aspire to? What do you hope for? And I have to tell you, that was the most heartwarming antidote to this whole epidemic. It was better than Prozac, I have to tell you. Because what we heard there was those children see themselves as human beings who want to just get on with their lives. They want to get married. They want to have children. One or two of them wanted to be bank managers and accountants. It was the normality of it that was the most striking. And I think if we can just bear in mind that is all we're trying to do, is give those children back their lives. I think we should all feel really empowered to, as Chip says, not only go from a slow trot to a bit of a gallop, but actually to start sprinting towards the end game of really making a difference in pediatrics. So thank you for coming today. Thank you for your interest. And again, thank you to all the partners who are doing such fantastic work. Long may it continue.